Tobacco use prevention can be a Sisyphean task. Just as we think we have finally made some headway in tackling youth tobacco use, a new threat emerges. After years of success in reducing tobacco's influence on our nation's health, it is troubling to note a resurgence of nicotine use under a new guise, electronic cigarettes. While regular cigarette use by teens has dropped by almost half over the last 3 years, the use of e-cigarettes has increased 9-fold. Even more troubling are the persistent misconceptions and lack of knowledge about the dangers of nicotine itself. To address those misperceptions and underscore the dangers of nicotine, we're going to discuss e-cigarettes on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Most people understand the dangers of tobacco use, but many are unaware of the health risks of nicotine, especially for youth. They know nicotine is highly addictive, but assume it's otherwise harmless. The reality is that nicotine can be very damaging or even fatal in high enough doses. Because of that, the Minnesota Department of Health recently issued a nicotine health advisory alerting the healthcare community and parents about the dangers of nicotine use by youth and pregnant women. To look more specifically at this issue, I've invited 2 members of the Physician Advocacy Network, an effort of the Twin Cities Medical Society, which is there to increase e-cigarette awareness among Minnesota physicians and engage healthcare providers as advocates in communities and patient rooms. My guests are Ellie Parker, the project director, and Peter Dehnel, the project's medical director. Both have a long history of working in tobacco control and on other public health issues. Ellie and Peter, welcome to our program.
Good morning.
Thank you.
Thank you for being here on an issue that really is sort of relatively new in the public health world, e-cigarettes. They haven't been around for a long time. So Ellie, I want to start out just basically right from the beginning is, what is an e-cigarette?
That's a great question. E-cigarettes are battery-operated devices that are designed to deliver nicotine just like a conventional cigarette would. The only difference is that e-cigarettes also deliver flavorings as well. There's hundreds of varieties, and the important thing to realize is that they're all very unique in the way that they are designed and in the way that they deliver nicotine.
Are they sort of a new thing, aren't they? How long have e-cigarettes been around?
They became available in the United States in 2007. And since then, we've just seen that more and more youth are using these products, which is really what was so concerning and why the Physicians Advocacy Network began from the Twin Cities Medical Society.
Yeah. Peter, you and I have been in the medical field for a long time, and certainly when I trained back in the good old days, e-cigarettes weren't even a consideration. Has that been an issue that maybe physicians and healthcare providers didn't recognize e-cigarettes as an issue?
Yeah, I think, and I can just point to myself, up until a couple of years ago, I thought e-cigarettes were not a big deal, but that was out of purely a stance of not knowing what they were really involved with. So what we have, as Ellie pointed out, a system whereby the nicotine from tobacco is extracted directly from tobacco. It's put into a liquid. That liquid is then put into an e-cigarette, and then that's heated. And there's a lot of things that are added to the extracted nicotine from tobacco that either make it more flavorful or less irritating to the throat, or give a sense that now, especially in the pediatric world, now you're acting like an adult. You're using this e-cigarette, which is kind of a big person thing to do.
Mm-hmm. Now, we've been working on tobacco control for over 50 years, or probably even longer after the 1964 Surgeon General's report, really making good progress. And we know about all of the problems of tobacco and all of the additives that are in there and all the chemicals. Is it the same kind of things in e-cigarettes? Because I'm hearing that people say, well, it's less damaging. What's the damage caused by the nicotine?
So there's a couple things with that, Ed. There's the whole issue of this if you will, this juice, the e-cigarette juice, is extracted directly from tobacco. It's not manufactured in some other way, so not only do you get the nicotine from tobacco, but you get all the other carcinogens and other things that are naturally in tobacco, which are harmful to people in general. Then the manufacturers of these things, and they've gotten quite sophisticated, they will add flavorings and other stabilizers and probably a number of other chemicals, which makes the nicotine more available to the body to absorb within the lungs. So, I mean, the tobacco companies have been very creative in this space for years, and now they've just branched out into another area, and that's called e-cigarettes.
Mm-hmm. Now, I know a lot of the focus has been on youth. Is it a particular problem for youth using e-cigarettes?
And I think that's a really good point, is that the brain itself doesn't stop developing until the early 20s. And so that's why back in the days of cigarettes, it was so much more addictive for teenagers to get starting to use tobacco products. Well, that's now just translated into electronic cigarettes, where the brain is much more susceptible to the effects of nicotine, and you basically create a need for nicotine going forward the younger you start with these products.
Okay, so the adolescents are more, it's more toxic for adolescents, particularly for brain development for adults whose brains are fully developed. So this is a particular issue for adolescents and young children?
Yeah, and so for example, the American Academy of Pediatrics has done a lot of work in the last couple of months especially, including a recent policy statement around the helping to protect adolescents and pediatric patients from the exposure to and use of electronic cigarettes.
Mm-hmm. Now, Ellie, I understand the rate of increase in use of e-cigarettes among kids has really increased, and actually I have a slide showing that how it's been increasing. Tell me a little bit about the really increase in use of e-cigarettes.
It has. In Minnesota, more adolescents are now using e-cigarettes than combustible tobacco, and this is a nationwide trend. It's appearing more and more in the news that it's increased 3 times as much as it has in the past, that they're using these e-cigarettes. And what we're concerned about is that these are really a gateway device into that nicotine addiction that Pete was talking about.
Mm-hmm. Could it be that some of the kids who were using cigarettes now use e-cigarettes, and couldn't that be an argument to say, well, they're just using something that maybe is safer than regular tobacco?
Absolutely, and that's another thing that we're noticing is that more teens are using dual use, so they may use e-cigarettes and cigarettes. So that's also a concern, is that it's actually dual use and they're not choosing one or the other product.
And I also understand that there are a significant percentage of kids who've never used tobacco who are using e-cigarettes. Why do you think that would be?
I would suggest that the flavorings, there are a couple of reasons. There's the flavorings which are very appealing to children. They come in chocolate, strawberry, any menu of flavor that you can imagine a kid would be interested in. And then also accessibility. Kids are able to purchase these online. In Minnesota, you must be 18, which is great. However, there is an internet market available for children. And then beyond that, just the way that they're able to actually use the devices in places where adults may not recognize the devices, and so they're able to actually use those products.
Pete, it's really illegal to sell e-cigarettes to kids under the age of 18 in Minnesota, and in most states, I suspect. And yet we hear things like gummy bear and Skittles flavors and chocolate. Tell me what's the disconnect here?
Well, so again, the tobacco companies and the companies that are selling these products know really their target market. They know where they want to have usage start. And so there's a variety of ways that they will work around the regulations and the safeguards that we have in place in terms of legal age of purchase and various other things, because to Ellie's point, you can go onto the internet right now, say you're 18 years of age or older, and there's no problem. And I suspect it would be a very hard thing to regulate the distribution of these products through mail order or other, once you get your order into the internet, it'd be hard to regulate that beyond that.
It sounds like this is a tool to get kids addicted to nicotine, which eventually get them to use tobacco products, would be my guess. Is that what you're seeing?
In some initial, this is where we need a lot more research, because this is a very new field in some ways. Tobacco has been a very old field, of course, and we know what nicotine does. We know how kids and adults get addicted, but what we don't know is the particular delivery system with the electronic cigarettes. It's very creative.
All right. I want to talk about actually nicotine poisoning, because that's been a huge issue in the news, but first we need to take a little break. We'll be back right after this message.
The aromatic annual called tobacco.
Welcome back. We're talking about e-cigarette use, particularly among youth and adolescents, with Ellie Parker and Peter Dehnel from the Physician Advocacy Network. I'm going to talk just briefly about the Physician Advocacy Network, because this is a new thing. Ellie, what is the Physician Advocacy Network?
Yeah, the Physician Advocacy Network is an initiative of Twin Cities Medical Society. It's funded through the Blue Cross Blue Shield Center for Prevention. And this began in February, and it really started from the fact that in 2007, when Minnesota passed the Freedom to Breathe Clean Indoor Air Law, physicians were very involved in that, and they really spoke out about the dangers of secondhand smoke exposure. And so what we're realizing is that now, in 2015, many of those ordinances of the Clean Indoor Air Law, e-cigarettes are not included in those. And so we're seeing more and more local communities begin to address those issues. And so really the purpose of the Physician Advocacy Network is to educate and engage physicians in new tobacco products. So the main purpose is to educate and increase awareness of these products among physicians statewide. And then as these local ordinances appear, that we're able to actually mobilize physicians as advocates, both in patient rooms, within their own health systems, and then within their local communities. And as of today, we've actually worked with over 300 different healthcare physicians and providers, and so that's fabulous. And then there are also now 12 counties and 24 cities in Minneapolis, in Minnesota, excuse me, that have included e-cigarettes in their clean indoor air.
Peter, is there a real need to educate physicians about e-cigarettes? I think I sort of started off our conversation as this was not part of our training early on.
Yeah, and I think this has been very much under the radar screen for physicians. Many of the professional organizations until this last year really haven't been in a position to help physicians get educated about what electronic cigarettes are. But e-cigarettes are now very much a definite consideration that physicians need to address. And there is a big need because in 2007 to now, that's only 8 years, and it takes quite a while for medical information to be disseminated and adopted and embraced in terms of what its real impact is likely to be.
Yeah, and it sounds like from the data, the increased use is increasing dramatically, and we've really kind of fallen behind in terms of the educational pieces.
Yeah, and I think there's actually some misinformation out there about electronic cigarettes. There's this sense that, well, they're safer. If you go on to like TV and things, you'll see, well, this vapor that's going out, it's just like water vapor. It's not harmful to people. E-cigarettes themselves are real safe for people to use, and you don't have all the bad things about tobacco use.
Mm-hmm. So tell me a little bit about the ordinances. In Minnesota, we have Clean Indoor Air Act. How does that incorporate e-cigarettes? Can they be used in the same places or in places where tobacco cannot be used?
Sure.
Or are they the same?
Statewide, there's not that ordinance yet, but the communities that are making that decision, it's basically that anywhere you cannot use a conventional cigarette, you cannot use e-cigarettes as well. So it's public places that's covered. So it just basically ties in an e-cigarette with the existing ordinance.
Right. And so what are local communities doing? How can they really be helpful in banning the use of e-cigarettes in places where kids are?
Well, I think it really begins with education and understanding what e-cigarettes are, and understanding that while we may not know everything about them, we do know the harms of nicotine, and then taking that conversation with other community members and addressing that with City Council, because I think it's going to take a lot of local ordinances before the state reacts to this, and so we really need to have that local, that grassroots beginning to this.
Right. And Peter, as a pediatrician, I see that we've had an increasing emergency room calls and poison control calls related to e-cigarettes because of that nicotine itself is really toxic, particularly to infants and young children if they ingest it. And I've got a slide here showing the e-cigarette related poisonings among Minnesota children under the age of 5, and we've seen a huge increase. Tell me about the concerns about nicotine and kids.
So it doesn't take much in the way of milligrams of nicotine to cause nicotine poisoning in young children, and it takes they talk about a lethal dose, and it's somewhere for half of kids that get exposed to 1 milligram per kilogram, or 1 milligram for every 2.2 pounds of child's weight, that if they get that much exposure. And in a simple bottle of e-juice, the stuff that goes into electronic cigarette, there's a far greater dose potential in that bottle that is lethal to a child if they get a hold of it. I mean, it's in some ways far more dangerous than getting a hold of a handgun, because they can just open this bottle and ingest the contents, and it's a lethal dose of nicotine potentially.
Right. And these things, from what I understand, are flavored. And they could be flavored with things that are really appealing to infants and young children.
Oh yeah, when you talk about bubble gum and cotton candy and Skittles and you just look at hundreds of different potential flavorings that are out there.
And Ellie, so this raises the point that there's really actually two kinds of e-cigarettes, aren't there? The kind that everything is contained within
Yes.
a cartridge that gets put into an e-cigarette, or one cigarette is sort of disposable. And then there's the e-juice. Tell us a little bit, Ellie, how these are different.
Sure. So a disposable e-cigarette, that's actually where it's already pre-filled and you don't have to handle the liquid nicotine, and you just remove the cap and it's able to puff. And they range in the variety of puffs available in those, so it's really hard to also determine how many cigarettes would be in one conventional e-cigarette, because again, it's all going to depend how frequently users use it. But then the other type of e-cigarette, and again, there are many different types. You can control how much vapor is released, and so there are very, very different varieties, which also make it very hard to do research, because again, they're not, you're not always comparing apples to apples. But with those other types of e-cigarettes where you actually have to refill, you have the liquid nicotine, and then you actually have to pour that into the e-cigarette, which can be very dangerous when handling that, because if that liquid nicotine was to come in contact with your skin, it can be absorbed through that, which brings up the point of the poisonings.
Yeah. Does the e-juice come in child-proof containers?
In Minnesota, that is a law, so that is supposed to, that should now be, we should be seeing that. However, we know that children are very, they have unique ways of being able to open those devices, so that is a concern. And so one thing that we really want to make sure is that parents are keeping that e-juice stored somewhere safe where children don't have access to it.
Peter, we've had a lot of effort in controlling where cigarettes get sold. Where can people get e-cigarettes? How available are they?
They're far more available than what standard tobacco products are, and there just isn't the same level of regulation in terms of the availability of these e-cigarettes. So you can get easy access to them at just about any place. Convenience stores, gas stations. They have what are called vaping lounges. They have e-cigarette stores that are set up, so you can get them in a variety of places, whereas you just don't see that same level of availability of tobacco products anymore.
All right. I want to talk a little bit about what needs to happen, what physicians need to do, what clinics need to do, what parents need to do, but first we need to take one more little break. We'll be back right after this message.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Welcome back. We're talking about e-cigarette use with youth in Minnesota with Ellie Parker and Peter Dehnel from the Physician Advocacy Network. Before I get into really talking about what can be done, what needs to be done, there's one other issue. We've talked about flavoring in e-cigarettes, but I also know that other tobacco products, regular tobacco products, are really being also flavored in a whole variety of ways. And we're seeing an increase in use of flavored kind of tobacco. And I've got a little slide here that's showing that 7 out of 10 middle school and high school students who actually use tobacco products have been using a flavored product. Ellie, can you talk a little bit about what's going on with the flavors and what's going on with children and tobacco use?
Sure. Well, we know that kids are drawn to these flavorings, that's kind of the tobacco markets. That's the whole reason that they make these products, is to attract youth. And a lot of kids perceive these products to be less dangerous, they're less harsh on their throat, and they really don't think they can become addicted to these flavored products. But unfortunately, they start with that product, and what we see is that eventually they graduate from the flavorings and then begin using your conventional tobacco
Yeah.
products.
And I understand, menthol is also a huge issue, particularly among populations of color. Are you seeing that as one of the issues in Minnesota that we have to deal with?
It most definitely is, and I think that will be a project of the future. I know that Minneapolis and St. Paul right now are both considering flavorings and that they're restricting the sale of those, and so I definitely think that there is a real gap in the fact that menthol are used among vulnerable populations.
And Peter, this must say that the tobacco industry knows what they're doing. They say they don't target to children, but obviously with flavors, with the kind that we've talked about, they have to be targeting to kids.
Well, the tobacco industry, they have literally decades of experience, and they have very sophisticated marketing departments. They have very sophisticated research departments to know how this stuff is going to be most available to the end user of the product. So they are far more creative than what we give them credit for a lot of times. But yes, they know what they need to do to target, whether it be children or certain vulnerable populations. And in Minnesota, we know there is a disparity in terms of use, both of tobacco products and probably of these new products coming out as well.
Mm-hmm. So where do we go from here? The Physician Advocacy Network is there to work with the healthcare world and the patients that they deal with. So how are you moving forward on this? Educating, doing policy change? Tell us where you're starting with this effort.
It's really, again, starting with education, making sure that providers have appropriate information so that they can begin the conversation with their patients and with the parents to address some of those concerns, that make sure that they're asking about the use of e-cigarettes in these new tobacco products. What we're finding is that a lot of physicians maybe are very used to asking about tobacco, but they're not including e-cigarettes and other products as tobacco products, and so making sure that they have those direct conversations about these new products so that they can educate them about the poisonings and about their, I guess, really fix some of those misconceptions that people are thinking about e-cigarettes.
Do you think the medical community has become complacent related to tobacco? We've had tremendous progress over the last 50 years, and we don't see tobacco used as much as. Do you think we've sort of fallen off on our attention to this issue?
Well, I think a couple things in that regard. I think it's just more of a lack of awareness as opposed to just maybe not as engaged. So I think that, and there are some challenges in terms of like building some of these questions into your electronic medical record, just because it's going to take a lot of change for that software or that system to be able to make sure that the prompt for not only tobacco use, which is there now and is being routinely asked, 95% plus of the time, those kind of tobacco-related questions are answered. But the e-cigarettes and these other forms of tobacco aren't necessarily built into the system yet, and that's what we really need to move to for physicians to really be able to engage this issue, so that so basically that they ask at every opportunity.
Mm-hmm. And what do parents know about e-cigarettes? What are you seeing in your clinics? Do parents really know what e-cigarettes are and the concerns that are there?
No, I think that parents are farther behind in terms of their knowledge than what physicians are. So once we can educate the medical community, we can then work to really educate parents in helping to make them know that this is a risk for their kids, and it is.
Mm-hmm. Now, I know that when the Freedom to Breathe Act got passed, physicians took a lead role in actually passing that legislation.
Sure.
Are they taking a lead role in local jurisdictions on getting other ordinances passed?
They are. They're really using their opinions and their expertise, and so that's really the whole purpose, is to educate these physicians so that when these local communities are considering these ordinances, we've been able to use physicians as advocates. They can write. They can testify in front of their city council members, they can write to their city council members, they can write letters to the editor of the paper, they can write articles. It's really about, once they're educated, being able to spread that knowledge and be advocates, again, in their patient rooms, within their own health systems, and then within their communities as well. So we are seeing that more and more physicians, once they learn about these products, they are realizing that this is something that they should be involved in.
Peter, I suspect that physicians start to recognize that they have a responsibility to their own individual patients, but also to the community at large, that public health mission that physicians have.
And that's what was so important the first time around with tobacco. This is like the second time around, it's going to be just as important.
Good. One last piece of advice to physicians who might be watching this program.
It's really important to address this. E-cigarettes are not safe. They're not a safe alternative to tobacco products. They are tobacco products. And in all cases, nicotine is nicotine is nicotine. It doesn't matter how it gets into a person's body.
All right, good. Well, thank you for the work that you're doing. Thank you for this information, and good luck as we try to keep e-cigarettes out of the hands of kids and out of hands of adults also.
Thank you.
Thank you, Ed.
I'll be back with a closing comment right after this message.
My son Aiden has asthma. Secondhand smoke has triggered his asthma so bad to the point where he had to end up in the emergency room. And he has spent multiple nights in intensive care. Now he's on a whole bunch of medications. My tip to you is, don't be shy to tell people not to smoke around your kids.
For free help, call 1-800-QUIT-NOW.
The prevention of youth tobacco use has been a public health priority since the 1964 Surgeon General's report on smoking and health. Efforts to educate youth and adults about the risks of tobacco have been successful in steadily decreasing cigarette use by children and adolescents. Today, fewer than 9.2% of high school students report smoking cigarettes. However, the advent of e-cigarettes has provided the purveyors of nicotine a new line of youth-oriented products that come with health risks not yet widely understood by parents or their children. More than 1/4 of high school students have tried e-cigarettes, despite it being illegal to sell to anyone under 18. Alarmingly, almost 1 in 4 Minnesota high school students who used e-cigarettes have never tried any other kind of tobacco. We shouldn't be surprised by these statistics because there has been a proliferation of e-cigarette products with thousands of new flavors like cotton candy, Skittles, and gummy bears in stores where youth shop every day. Most people understand the dangers of tobacco use, but many are unaware of the health risks of nicotine for youth. They know nicotine is highly addictive, but assume it's otherwise harmless. The reality is that nicotine can be very damaging to young children, adolescents, and unborn babies. In high doses, it can be fatal. And ongoing use of nicotine may harm brain development, which may have long-term effects on learning, memory, and attention. The evidence is mounting that no amount of nicotine is safe for pregnant women, children, and adolescents. With 50 years of experience working to prevent conventional tobacco among youth, we should quickly take steps to protect youth from electronic nicotine use before it becomes, like tobacco use in the past, the new norm for our children. I don't want the health commissioner of 2065, because of our inaction, to have to worry about the plague of health problems caused by nicotine. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.